I want to start by telling you a story. A couple of hundred years ago, we didn't really know a lot about infections because we didn't even really know much about germs. Bacteria, viruses, those really weren't known. But there used to be a problem that women would get when they were in labor and delivery. It was called childbed fever or puerperal fever. We now know it was an infection, but back then they didn't know. But it led to a lot of mothers and babies dying, and it was a very serious infection. Well, in the middle of the 19th century, a doctor by the name of Ignaz Semmelweis recognized an interesting thing in his hospital in Vienna. The maternity ward that was managed by the midwives had a much lower risk of this fever developing than the ward that was managed by the doctors. So he tried to find what the difference was between the two situations. And the one big difference was that the doctors were frequently coming from the morgue, where they were teaching anatomy to the medical students. So he came up with this radical idea: maybe there's something coming from between the morgue to the maternity ward, and maybe these doctors should wash their hands. It met with a lot of resistance. Even though the facts actually started to show that this puerperal fever dropped dramatically in rates if people did wash their hands, there was a lot of resistance. Kind of sounds a little similar to some of the resistance to the science in the current pandemic. But as a result, ultimately, that practice changed, and from then on, doctors have been very diligent about washing their hands. So now let's fast forward to the mid-1980s, 35 years ago. I'm picking that time because that's when I started my medical education. And we had all learned from that, and every time we went and saw patients, we would wash our hands before each one. But one interesting thing, we were expected to look a certain prim and proper way when we were on the wards. So that meant for the men, we would wear long sleeve shirts, ties, long white lab coat. We would still wash our hands, but it doesn't take too much imagination to realize that maybe the tie and maybe the cuffs of our sleeves would still touch patients and carry things from room to room. So there would still be little outbreaks of certain types of infections that would happen. So over the last few decades, we've started to make some slow progress in reducing that, to the point where today, long sleeves are not allowed on the ward. If you have a long sleeve shirt, you need to roll it up. Men are not supposed to wear ties. And we wash our hands every time we go into the room, also every time we go into the ward, and every time we go into the hospital. And when we leave, we do exactly the same. We wash as soon as we leave the room, leave the ward, leave the hospital. If I just need to go and do rounds on one patient of mine in hospital, I wash my hands 6 times. That's not to say outbreaks don't still happen, but we've made a lot of progress in that regard. Now let's fast forward to today. We're in the midst of a pandemic. Hopefully we're starting to see the end of it. But we've had to make a lot of adaptation as a result. And the interesting thing is, because this is a pandemic and not just an outbreak in hospital, this is applying to everyone across the board, not just in the healthcare sector. We've all gotten good at wearing masks, keeping our distance, washing our hands, disinfecting surfaces. And we've had to adapt. So we're all really good now at doing meetings virtually with platforms like Zoom. And we don't go into work. We've learned how to work from home a lot of the time. And we have made all sorts of changes in that way to reduce the chance of infection. Ultimately, when the pandemic is over, declared finished, I think we won't go back to the old normal. There'll be some sort of hybrid model because a lot of this has actually worked well for patients. Well, I want to tell you about one thing we had to do in cardiology, because a lot of our patients require monitoring for their heart rhythm to diagnose if they have any serious rhythm concerns or if maybe their palpitations are from something benign. But it was hard, especially at the beginning of the pandemic, when it was not so easy for patients to come into the office or they were scared to come in. So we had to come up with a new system of how to do it. Normally they would come in, get connected with a few wires, take this device home, wear it for anywhere from 1 day to 2 weeks, bring it back, and we would reverse the process and then interrogate the information. We came up with a system now where we can mail it to patients. It's smaller, it's easier, they just stick it on their chest, they call a 1-800 number to help confirm that it's working, and how we do that is it comes with a BlackBerry device so that the information can be looked at in real time. So in fact, if somebody is at home and passes out, when they come to, they could actually call the 1-800 number and we can immediately look to see what has happened. So although that was in response to the pandemic, we ended up actually improving a lot on the system. People don't have to travel, they don't have to wear a more bulky device, and it can show us the information in real time. So we took a lesson from that and we said, well, how can we make it even better? What else can we do? Ideally, We want to have it comfortable for patients that they could wear almost all the time, because sometimes people have their symptoms intermittently. Let's say it's only every few months. How are we going to catch those episodes? So what we ended up doing is we're now working with a company so that we can have something that's on their skin more or less all the time, monitoring all the time. And what we're working with is undergarments. Most people wear underwear, so we can make it so it's comfortable. It has the ability to record the ECG information, the heart's electrical activity, and it records on a chip which then gets uploaded to a cloud. And what's nice about that is when we talk to our patients, they could say, you know, on September 5, I had a real severe episode of lightheadedness and I thought I was going to pass out. We can go back into that information and look exactly what happened at that time to determine if there was any rhythm abnormality playing a part. So what I'm trying to get at here is I'm pointing out how at one point we made progress when Dr. Semmelweis recognized hand washing was important. We didn't make a lot of progress right up until the time I started my medical education. We knew we still had to wash hands, but not much more. Now, in the last 35 years, we've made lots of other slow inroads to reducing the risk of infection. But a pandemic forced us to start to act and adapt as best as we could. Not just the healthcare sector, I know the business sector had to adapt too, but we've taken this lesson and said, how can we continue to provide services to our clients that are even better? How can we make it even more convenient for them, better for them, so we have all this information? So what I think I'm recommending for you folks is take that to heart. Don't just recognize that you adapted to a crisis, a pandemic, but take that the next step further. Recognize that there are ways that you can continue to improve services for your clients and your customers. Keep thinking that we want to make it convenient, easy. If it can be done virtually or remotely, that is a lot better than having people come in. I mean, I recognize Walmart's a pretty cool place, but I think Amazon's even better. And there's a big reason why it's one of the biggest companies in the world. So try to take the lessons that you've all been forced to take to heart with this pandemic. Now take it the next step further. Think outside the box, adapt, try to identify issues that could be improved upon without waiting for the next global crisis. Thanks very much for listening, and I wish you lots of success in your upcoming careers.